Is psychiatry right for you? Well, in this video, I'm going to be going over 5 reasons why I feel psychiatry is right for you. So stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. I'm glad to have seen you, and I am going to make this video a little bit shorter, making a video while driving because I drive a lot, so I might as well make more videos for each of you guys so you guys can enjoy it. So recently I made a video about whether or not psychiatry is right for you based off of 5 negative things, not necessarily negative things, but 5 things that you should take in consideration to see if it's actually right for you. And yeah, it seems like a lot of those things are things that you should look out for, and if you do have them, then it might not be right for you. But I need to make a video on the other end of the spectrum because I need to be fair, and I want to make sure you feel like psychiatry is going to be right for you. And if you have these 5 things and 5 different topics, ideas, or 5 different things, like I said, that might make psychiatry right for you. So let's get started. So 1, psychiatry is right for you if you love to talk. Talking is probably the biggest thing. So talking is one of those things that you just have to be somewhat either natural at it or have some sort of skill to be able to talk to patients, because at the end of the day, the biggest part of working in psychiatry is to be able to communicate with patients, be able to come across what you want them to know, or to be able to grasp ideas or symptoms that they may have by them talking to you. And if you can't talk, then yeah, you're just not going to be able to do this job, because a lot of it is subjective. A lot of it is you asking the right set of questions and you talking to them in a certain style for them to divulge information that you need in order for you to diagnose, in order for you to give them the right sort of treatment plan going forward. So the second thing that you should have is the ability to educate. So a huge component within our role working in psychiatry is to be able to educate. And if you love educating, then psychiatry is right for you, because if you're able to educate and you have a passion to educate patients and a passion to let them know why you're doing certain things, or why you're prescribing certain things, or why you're even asking certain things, and educating about the disease process or the psychological process of what may be going on, then psychiatry is good, because you're able to actually let them know why certain things are going on. It's similar to communicating, but I feel like communicating and educating is somewhat different, because you can talk to someone and go about and ask them the right questions, but then you might not be able to properly educate someone because you can't articulate what you want or what the knowledge base that you're trying to come across with, and you might not educate them properly. So the third thing that might make you right for psychiatry is your ability to solve problems, and if you love it. So the reason why I say this is because honestly, with psychiatry, it's a little bit different. It's not one of those things where it's clear cut. I know certain other medical conditions are relatively clear cut in terms of the diagnoses. So a lot of the times they'll present in a certain way, and you'll be able to diagnose it based off of either diagnostic studies, diagnostic things like X-rays, CTs, EKGs, and then also looking at a certain amount of symptoms, and they pretty much lay down, okay, if they meet this symptom, and then this diagnostic tool that you use shows certain things, then you can say like, okay, this is the disease. But within mental health, it's one of those things where it might not be clear cut. You might be dealing with certain criteria such as bipolar 1 or 2, and they don't meet every single diagnostic criteria, and so you try to diagnose them with certain medications, and they might react in a certain way, like you thinking it's depression or anxiety and starting them on an SSRI, and then they're going to be pushed into mania and having a full-blown manic episode. And even though you ask all the right questions, you assess them for all the scales, things like that, and they didn't meet criteria until they were put on the medication. And that's the beauty of working in psychiatry. And if you love to solve a good mystery, is you're able to do that, and you're able to find ways to solve crimes, so to speak, or solve mysteries, so to speak, and coming up with the right diagnoses and being okay with that. Because if you don't like doing that, and if you don't like putting pieces together, things like that, then it might not be right for you. Because that's the beauty of psychiatry, is being able to properly assessing someone and putting pieces together and talking to different parties, like collateral, and so to speak, like their parents or their partners or their children, to find out how their behaviors are, and ultimately putting those pieces together to coming up with the right diagnosis. So the fourth thing is you love helping patients with mental health issues. So that's a big thing, is because there are certain people in this world that might not have the right attitude or the right capabilities to help people with mental health. And if you love and you absolutely adore personalities and being able to help and distinguish certain other personalities within mental health and dealing with it, then psychiatry might be right for you, because you get to deal with this on a daily basis. Yes, you're going to have relatively stable patients, and you're going to deal, if you're already used to dealing with like depression, anxiety, things like that. But if you want to deal with patients that are bipolar, patients that have schizophrenia, some patients that have some sort of mental health disorder, and you're willing to, and you love, and you're passionate about this, then mental health and working in psychiatry is right for you. So the fifth and final thing is, if you're passionate about wanting to help, and yes, it goes hand in hand with the fourth one, and I feel like you have to have a passion to help. Yes, you might have a passion to deal with mental health patients, but then you have to have a passion for what you want to do, especially working in psychiatry. And if you saw my previous video about having a solid grasp about with your own mental health prior to working, and that you should have that solid grasp, then it goes hand in hand with this one, because you want to be able to actually help and have a passion to help these patients. And if you don't have a passion for it, and you're just going into this field of psychiatry because it's booming, so to speak, and you don't have this passion, then what makes you think you're not going to have to deal with all of these demons? And what makes you think you're not going to have to deal with just dealing with burnout, so to speak? Because you have to love what you do. And if you want to work in psychiatry, you're going to have to love to deal with this, because so many different things are going to arise, and so you're going to deal with so many different types of personalities. You're going to deal with so many different types of medications, and you have to grind. You have to put in the work in order for you to do this. And if you're not passionate about this, then all this hard work that you're going to be putting into helping these patients, it's going to be tough to deal with. And I don't want to sound like a Debbie Downer and saying, oh, you're not going to do well, but you might not do well, especially if you're not passionate about what you do. So yeah, so those are 5 different things that if you have these certain traits or certain things, then psychiatry might be right for you. Is because all of these things, well, you can technically apply all of these things to different roles within psychiatry, or different roles within mental health, or different roles within just the medical field. But I feel like these 5 things you should have a solid grasp of, or you should have these traits or ideas or things or possessions or whatever it is. But you should have these things if you want to be successful within psychiatry, because if 1, you can't talk, then it's going to be hard. If 2, you can't educate, it's going to be even harder, especially for our patients, because this is what they need. And 3, if you're not passionate about mental health or dealing with these population of patients, then it's going to be harder. And you have to be passionate for what you do, because yeah, it's just, it can be taxing on the body, can be taxing on our brain, and it can be taxing on our own mental health. And if you don't possess some of these things, you're either doing injustice to the patient or you're doing injustice to yourself. Yeah, I just wanted to make a quick video because I wanted to be like Dr. Buck Parker with his party people. I love watching these videos whenever I drive. But yeah, I wanted to make a video since I do have longer drives now, and just wanted to give you 5 things that you should consider to be successful within psychiatry, and 5 things that knowing that you'll do good in psychiatry. As always, guys, have a wonderful day, and don't forget to give this video a big thumbs up, and don't forget to subscribe also if you haven't subscribed already, and follow me on Instagram at PsychiatryDude. Have a wonderful day, guys. Bye.